Good evening, everyone. Yes, it is April 1st, and that's not why we picked this topic on this day. We know already that 'tis the season because we've had a few warm days. So we're just excited to have with us Dr. Shane. I really do consider him an expert on this topic, and we're very, very blessed to have this man. I know you had a busy day today in the office. Come and join us this evening. April specials. We really have three of them. There's a couple others, but the main one is a product of the month. So your lavender. And my very favorite, once a year, get it while it lasts, the rose duet. Or you can buy them individually. And to be honest, guys, I buy four and that lasts me the entire year. So I use it very sparingly though, because I want to make sure I have enough for the entire year. And then celebrate Mother's Day with these limited. Whisper, one of my very, very favorites, beautiful and shine. So inspire confidence, care, and radiance inside and out. So just an amazing, wonderful April specials. And then if you are introducing someone either on the call tonight or going forward, if they have an enrollment kit of at least 250 the month of April, 20% off is huge. I was thinking maybe more like 10, but it's 20%. This is a Silver Club event, which means anybody that is enrolling tonight, reach out to whoever you got invited by. And then keep in mind that this special is good for anybody that enrolls in the month of March, April, and May. So we got 2 more full months. I know there's a number of people on my team that is going through Silver Club, and reach out to your upline or somewhere to get that if you are enrolling as well. Next week, we got Dr. Janet Rorick. She's going to be talking about spring and summer health for pets. And we know what along with that comes fireworks and frontline and thunderstorms and all kinds of things. And we had our first last month. We're having another one this coming Thursday on the 9th, a week from tomorrow, with Dr. Lynn, another unplugged. It was really, really good. So if you're in the area, please join us. And then I'm trying something new. If you're in the area as well, on April 13th, I'm doing a glow event, a glow gathering. So we'd love to see you. On the 15th, a very important topic, balancing blood sugar naturally. That's continuing ed. And then on the 22nd, Jody is astrology and essentials made easy. And then, as I think everybody on the call knows, Dr. Ruth and Dr. Goff, Dr. Andrew, Smart Supplementation Decoded. And we are very excited to have. Also, everyone mark your calendars for June 17th.
While they're at their weakest position.
As we have Dr. Riggs flying in from Utah. So please mark your calendars, come to Baldwin, watch. We hope in the next week or two we'll have some more details. So without further ado, I'm going to stop sharing, and I'm very, very excited to have with us Dr. Shane.
Thank you, Sandy. Thank you. Let me get this pulled up here a second. Okay. Think we are good to go. Awesome. Well, again, thank you, Sandy. I love coming on here. Been doing it for what, 5 years or so, I believe. So
long time.
Yes. And I see a lot of familiar faces, so good to see everybody. But for those who don't know me, my name is Dr. Shane. I am a chiropractor, but also practice functional holistic medicine. So just trying to help people really get to the root of their issues. Why are we having some of these issues? Why did they come about in the first place? And then use a natural holistic approach to get you back to health, get things back in order, back in balance. So in tonight's topic, I want to talk about Lyme. As it's starting to get warm, at least here in the Midwest, things are starting to warm up. I saw some 85 degrees out there, so a little jealous, but especially here as things are starting to warm up, the ticks are starting to come out. I already found one on my dog this last weekend, so it is happening. But when we talk about Lyme disease, I became really passionate about this topic because I've seen firsthand, I've seen my mom go through the thick of it. So that's why I became passionate because as time has gone on, technology, testing, a lot of these different things, and just even our knowledge about Lyme has increased. But I've seen it when it wasn't good and how it went misdiagnosed, and she just kind of got thrown through the gambit. It was really just kind of a guinea pig and a test subject for years and years and years, until she finally found somebody who was what they consider Lyme literate. They have Lyme literate practitioners, and was diagnosed and then treated appropriately, and now is doing much, much better. But I just want to dive into this with you guys. My goal tonight is to teach you about Lyme, teach you about some things that you can do to help be preventative and support the body. Um, but at the same time, kind of teach you some of the myths. There's a lot of myths behind Lyme as well. And then if it is something that you have dealt with in the past, are currently dealing with, or maybe after tonight you're like, this might be me. I'm here to help you, point you in the right direction with that. Again, this is a huge part of my practice. I work with tons of people and have a lot of success cases with this. But let's dive in. Here we go. So, right, why are we talking about this topic? Here, right, I'm in Wisconsin, but Lyme is really across the United States now. But this is Lyme disease incidence just in Wisconsin, and this was as of 2024. Okay, this was the same chart back in 1990 and 1992. Okay, same colors, same representation, but you can see a lot of light blues, a couple darker blues, even some whites. We come here, there's no white, right? No white, mostly darker blue to really dark blue. Okay. So our cases over those years have increased drastically through the time. And again, is there more Lyme? I think there could be, but I think again, I think through time, our technology has gotten better, our sciences have gotten better, our ability to actually recognize and diagnose as Lyme has gotten better. So I think there's a lot of factors that start to play into this. Okay. Oops, wrong direction. But again, it's gotten worse, right? And this is just from the end of last or
You're muted, Dr. Shane.
okay. Are we good
There
now?
you go. Thank you. Yep, you're
Okay.
good.
Oops. I don't know how much you missed, but again, we see that increase in the amount of Lyme disease just in that Wisconsin, and that's going to be the same throughout the country. Obviously, here in the Midwest, it's a little more prevalent than some other states, but we see that, right? There's an uptick in the number of ticks in Wisconsin alone. We look at, okay, Lyme disease cases surge 1,800% as ticks start to spread across Michigan, right? So we're seeing these different things. Even RFK and some different people are recognizing this and saying, "Hey, I think this is an issue. It's a bigger issue than what we think it is. So we really need to put some more measures and some different things in this to say, hey, we need some new diagnostic efforts." Because really, and we'll talk about that. I think that's been one of the big issues through time is actually getting quality tests and having practitioners that can read them appropriately and then appropriately say, yes, you have Lyme disease. Okay. So I think that's been part of that big issue, and we'll talk about it. But when it comes to Lyme really got its name because the first case was discovered in Lyme, Connecticut. Okay. When we look at it scientifically, the bacteria that Lyme is called Borrelia burgdorferi. Okay, Borrelia is the bacteria, and then everybody throughout time and science threw their last name on everything. So Willie Burgdorferi was the guy that found it, right? So if you ever see Borrelia, typically they're talking about Lyme disease. Okay, and really, this has been around for a long time. They found they call him Otzi. He was a man that was frozen in a cave when they took him out and started analyzing him, he's over 5,300 years old from what they can tell, but he had Lyme in his system. Okay. So it's been around for thousands of years, getting into people and animals and different things like that. And at Borrelia, they consider it one of the most advanced single cell organisms. They actually talked about making its own classification. It's technically a bacteria. That's why a part of like the medical protocol is antibiotics, and we'll get into that later. But it acts like a parasite, but it also acts like a virus, and it's tricky. Okay, so knowing these things is part of that story. Very rapidly replicates. One turns into two, two turns into four, four turns into eight rather quickly. Okay. It's even faster than some of the cells in our natural immune system. So our natural defenses, a lot of times it can start to outrun in certain situations, and that's assuming we're healthy. Now, for somebody with a compromised immune system or are on immunosuppressants and different things like that, now that's even kind of compounded. And there's some different states that it can come along with. There's active state and insistent, and we'll talk about that in a second. But one big thing too is it loves to come with friends, and it comes with co-infections. So again, why we're talking about this is because, again, through time, things have really escalated as far as how we can start to look at this and getting to the root of the issue. I had this lady who had been dealing with quote unquote thyroid issues and had been diagnosed with Graves' disease for over 15 years. She was a chef. She loved cooking. She was really good at it. One of the biggest things was her over time rashes started to develop on her hand to the point where they would break open and bleed, and she had to quit her job because she's a chef, so she can't have that getting into people's food, right? I mean, on top of that, she was fatigued, she had joint pain. Again, she was diagnosed with that autoimmune thyroid. You could literally see her neck swollen. Her thyroid was so enlarged and so swollen that you could literally see it across her neck. Started getting hair loss, and she was very sensitive. She was very leery even coming to see me and saying, and when I was like, okay, here's what I would do, she was afraid. She was just afraid to take anything because she's seen numerous people through time, and they're just like throwing this and take that and do this, and she'd react to everything. So she was just downright scared to take even a simple supplement, even like a fish oil or just the simple things. She was scared. So again, making a plan with her, but again, she just was told, you have thyroid issues, you have Graves, this is going to be your thing forever. That's just how it is. Okay. And was given a medication for it. Well, turns out she had Lyme's. Okay. And she had chronic Lyme. That's what part of this test is. You can see kind of right in the middle there, she came back double positive for Lyme. And in that category, that means it's a previous exposure, meaning one that's more chronic from the past. You can also see that she had a co-infection of Bartonella. Okay, so when I look at this, and Lyme and even Bartonella have been shown to create autoimmune conditions. They're hard on the immune system, they're hard on the body. And so really when you look at that, because my question is, why do you have thyroid issues? Why are we having these immune system issues? Well, when you get to the root of it, Lyme ended up being the issue. They just never looked for it, never went down that path again for over 15 years. We found this, we started to address this issue, we started to address the Lyme, we started to address the Bartonella, her life changed. Okay. Her hands are now, this is about 9 months ago, her hands are almost clear, completely clear. Her energy is coming back, her hair is starting to come back. Again, the energy, the joint pain, just a different person, and she feels like she has her life back. Okay. So again, getting to the actual root of what was going on and not just saying, well, sorry, you have thyroid issues. That's just how it's going to be. And here's a Band-Aid for the rest of your life. Right. So we got to that. And again, I think that's where part of this issue and why this topic is important is this could be something that, again, we'll talk about what some of those misdiagnoses are, but really she was kind of misdiagnosed, right? They just, okay, well, here's what we see, so we're just going to put this on it. But really at the root of it, it ended up being those infections. Okay. When we look at Lyme, there's two classifications. There's active Lyme. So you have Lyme that is actively causing symptoms, causing issues in that body, causing all these problems, right? And you could have co-infections. Then there is what's called post-Lyme disease syndrome. Okay. So this is where maybe you have a successful treatment, you eradicate Lyme, but you still have the symptoms like you had Lyme. Okay. This is where the Lyme has caused damage and you get rid of it, but you don't repair the body. Okay. If your body's a house, Lyme is the fire. If all you do is put out the fire and you leave the house burnt up, right? The kitchen is burnt up, the bathrooms are burnt up, the bedrooms are burnt up, you still don't have a livable house. Okay. That's what's going on here. Active Lyme is there's a fire, it's causing havoc, right? Post Lyme disease is the fire's been put out, but you never addressed the mess that the fire caused. When we look at co-infections, there's quite a few that can start to pop up. Things like chlamydia, Bartonella, anaplasmosis, babesiosis. Again, that list kind of goes on for a few. All from my personal practice, again, I see a lot more people in the Midwest. I see people all over the United States, though. Bartonella is a really present one. I see that more often than any of the other co-infections, with anaplasmosis and babesiosis kind of right behind it. Okay. So that's really what we kind of start to see. And again, this is where I partly see it go wrong too, is people just test for Lyme and then they don't test for any of the co-infections. And a tick can carry multiple of these infections. So that's where, again, I think it's important that we turn over all those stones and make sure we're not missing anything. This is where Lyme can start to get tricky, okay? There's active Lyme. There's really three separate states that Lyme can be in the body. There is active Lyme, like you see on the picture on the left. It's free, it's getting around the body, it's replicating, it's causing the symptoms, it's causing inflammation, it's causing disruption of normal function. All those things that we think about Lyme, that's what's causing the issues is active Lyme. Then we have what's called encysted Lyme. This is kind of like a defense mode. Another name is called round bodies. That's what we typically see it as. If Lyme feels threatened, whether we're taking an antibiotic or even something natural sometimes, right? If it feels threatened, it's going to hide. I think of a turtle kind of curling up in its shell, okay? Now, when they're in this form, they're usually not causing as much issues, okay? Again, they're kind of inactive in that defense mode, so they're not active in causing all these symptoms and inflammation and different things to kind of just go into hiding. They can sit like this for up to 36 months and then reactivate, the research shows. 3 years. 3 years, okay? So imagine you take a round of antibiotics, or right, you got Lyme, you went to the doctor, they gave you antibiotics, you feel better, and then 6 months later, a year later, 3 years later, the Lyme that was in this form that the antibiotics didn't kill reactivates. You think you've been clear from Lyme for 3 years, again, whatever that time frame may be, and you're like, well, it can't be Lyme. We took care of that 3 years ago. Well, it still could be, unfortunately, right? So looking at that is it could be something that we're dealing with, and we'll talk about this a little bit more in depth later. The other form, so the third state that it can be in, is called a colony or a biofilm. Literally, I think of a little castle, okay? They create a fortress around themselves, they colonize and create this biofilm little castle around them, and there's a bunch in there, okay? And they're protecting themselves with that biofilm. So there's going to be things we'll talk about later, but biofilm busters. You got to break through that biofilm to get all the Lyme inside there to then start to take care of those. And these can be active, they can be encysted, they can come and go out of there as they please. And so again, just another tricky kind of method that they look for. Now, what carries Lyme? Again, we know the biggest and the most prevalent one is going to be a tick, but you can get it from mosquitoes, mites, fleas, biting flies, and things like that. But again, the most prevalent is going to be ticks by far. And the thing is one of the old myths was, well, it has to be an adult tick. And that's not necessarily true. Again, it is the most common, but the little tiny babies, right? There's larvae, which is the babies. There's nymphs, which is like the teenagers, let's call them, and then there's adults, okay? The larvae are the ones that we can hardly see. They're a pinpoint, right? And a lot of times we don't see them. They could bite us and we never even know. But those can technically carry Lyme. So some people are like, I've never really been bitten by a tick. And it's like, well, you might not even know that you got bitten by a tick or even several of them because they're so small, okay? And there's a few different types of ticks, and they typically carry different, like the deer tick or the blackleg tick. That's the most common one when we talk about Lyme. That's the one we're talking about, okay? There can be a Lone Star tick. Most commonly carries Rocky Mountain spotted fever, but can be other things, right? So that's what we're looking at as far as that goes. And they're in different regions throughout the United States. But again, when we talk about Lyme, it's most commonly that deer tick or the black-legged tick. So again, to get infected, we need to be bitten, okay? One of the initial things that we think about is going to be what they call that bullseye rash, and I'll show you what that looks like in a second. Typically, that's going to develop within the first week, 2 to 7 days, but roughly only about 30% of the time you're actually going to get that rash, okay? So you're more likely to not get the rash than you are to, but if you get a bullseye rash, that is the only 100% confirmatory sign that you have Lyme. If you got bit and you got a bullseye rash, you have Lyme, okay? But if you got bit and you didn't get a rash, that doesn't mean you're in the clear, okay? Because it only happens about 30% of the time. Now, one of the old myths is transmission time. Well, if I get bitten by a tick, it has to be attached for 24 hours to transmit it. That's old thinking. That's an old myth. Research now says it's more like 4 to 12 hours, but can be as little as 10 minutes. Okay. And I don't mean that to scare you. It really matters. There's several factors. What is the overall health of you? If you're stronger, you're going to be able to resist it better, right? Are there other infections that are coming with it? Did multiple ticks bite you, right? Are there co-infections in the tick themselves? So do you have other infections? Does the tick have other infections? There's a lot of factors that play into it. But I say, again, the more recent research says more like 4 to 12 hours as far as transmission time. But again, and we'll talk about it later what that looks like, but I always say the sooner the better. Act as soon as you possibly can. If you got bit, whether you get a bullseye rash or not, do something. Okay. And if you don't know what that is, you can call, talk to me. I can help. But again, we'll talk about that. You can see a picture of that bullseye rash. But if you do get bit and you do contract Lyme, this is what it's going to start to look like. Really, the first few days, even the first month, you're going to possibly get that bullseye rash. You're going to usually experience fatigue, fever, chills, headaches, muscle aches, joint pain, stiffness, swollen lymph nodes. Kind of like you have the flu, okay? That's what it's going to seem like. And again, if you have that bullseye rash like you see there, that's the big indicator, okay? But again, it can seem like I just have a cold, I just have a flu with those different things like that. So again, that's where it can look like other things and be misdiagnosed. Now, if you have Lyme disease, as you move on through these stages, right, we have it, we didn't catch it right away. Now we turn from days into weeks to even months. You can get multiple of those rashes, those bullseye rashes. You can start to get neurological symptoms like Bell's palsy, like you see over to the side. Again, the nervous system starts to be affected. Lyme can get it basically anywhere in the body. It can get into the nervous system, and that's what's called neurological Lyme. It can get into the heart, which is cardiac Lyme. It can get into the joints, which is known for. It can get into the digestive tract, the lung. It can get basically anywhere in the body and start to affect it, and that's what we see. But again, you can get that Bell's palsy. You can get meningitis types symptoms: a stiff neck, really sensitive to light, severe headaches, numbness, tingling in the hands and feet, all neurological things. Again, you can have heart issues. So this is that cardiac Lyme. Where you can have irregular heartbeats, you can have palpitations, so your heartbeat's kind of off rhythm. You can start to get dizziness or lightheaded. And then you can have your pain starting to migrate from different joints and tendons and muscles. They kind of move around. You're like, your shoulder hurts one day, my knee hurts another day, my elbow hurts, and it kind of pops around. Okay. What does that also sound like? Fibromyalgia, right? Okay. So we'll talk about that in a second, but I just wanted to point that out. Then, and this is chronic. So when we're talking months to years, so we didn't catch it, we didn't take care of it at the beginning. Now we're, again, months to years down the road, like my first example of what this will look like. Again, it can be severe joint pain and swelling. Lyme loves the joints. But again, what can this look like? Well, rheumatoid arthritis, right? But when we get diagnosed with rheumatoid arthritis, I'm asking why? Why do we have that? What is causing the inflammation and irritation and that autoimmune reaction inside that joint? Well, could be Lyme, right? Again, chronic fatigue. You could have eye issues. Lyme loves collagen, connective tissue, and that's what your eyes are. So if you have floaters, that can be Lyme. That can literally be the Lyme traveling across your eye, those floaters. Again, you can get Lyme brain. So again, cognitive issues, memory problems, difficulty concentrating, word finding difficulty, and things like that. Or neuropathy, again, that neurological shooting pain, numbness, tingling in the hands and feet. A lot of times you can start to get depression or mood changes because of all these things. And again, a lot of people, when they're chronic, for example, let's say my mom, she dealt with this. Basically, she was undiagnosed for 18 years and was just super sick, went on medical leave from work, went to hospital to doctor to different hospital to different doctor. They just kept guessing and doing this and doing that. And it wasn't if she had a headache that day, it was how bad is my headache going to be today, right? So she ended up getting depressed because she was just sick and tired of being sick and tired and getting no answers. Okay. So again, things that we start to see with that. And it can look so different in so many different people. It just depends on the individual. And again, where did that Lyme get into? Did it get into the heart? Did it get into the nervous system? Did it get into the joints? Did it get into all of them, right? It can look so different for everybody. Now, when we look at something like Bartonella, okay, similar, again, painful swollen lymph nodes. Again, a lot of neurological symptoms. That's what we see with Bartonella. It has more neurological effect to it. Again, anxiety, panic attacks, even hallucinations. You can have rage episodes. So I always kind of say, like, wherever you are on the spectrum of that, your fuse gets shorter. Okay. So everybody's a little different, right? Some people are just naturally a little angrier, I guess is what you would say. They're short, their fuse is shorter. Some people are the nicest people in the world, their fuse still gets shorter, right? So it just depends. It gets its name because of the stretch marks that you see there. It looks like a cat kind of scratched you. Can you get it from a cat? Yes, technically. But typically that's a cat that got bit by a tick that contracted it, and then they scratched or bit you and somehow and kind of transferred it over. So much more likely to get it from a tick than a cat in that method, more direct, right? Bone pain. I see this one often with my patients too that do have it. Their shins, their feet, specifically their heels. It's interesting. The soles of their feet hurt in the morning when they wake up. Couldn't tell you why, right? But that's just, it's one of the things it's known for. It can get into that system, get into those kind of bones and go down into the feet and start to cause that. Muscle pain, headaches, fatigue, again, eye issues, GI issues, insomnia, mood swings, different things like that. Okay, so, and here's, I've kind of alluded to this a couple times. Lyme is known as the great imitator. Okay, you just heard some of those different signs and those symptoms, and those things can look like so many other things. And I think this is, again, why we need to be having this talk is it's known as the great imitator because You don't find Lyme, you don't even look at Lyme as a possibility, but okay, you have some of those different signs and symptoms, they can start to look like other things, like let's say MS or Alzheimer's or Parkinson's or dementia, right? All these neurological symptoms that start to come on when really Lyme gets into the nervous system, starts to cause imbalances, starts to cause dysfunction, starts to cause damage. And now you have, you don't find Lyme or you don't even look, and now you get diagnosed with, let's say, MS, right? Is it really MS or is it you have Lyme that's now traveled to your nervous system? Okay, right? That's what it's known for. And I have several patients that are exactly like this. They were diagnosed with MS, end up coming to me, we tested, they have Lyme, right? Again, do they really have MS? I'm not trying to say that they don't, but MS is they have basically cysts on the spinal cord, but why? Well, because they have Lyme, and Lyme is known to create cysts, right? We talked about that earlier. So it's really the Lyme that is the issue. And the symptoms that are coming out look like symptoms of MS. Okay. But that goes the same with some of these other ones. Again, the Alzheimer's, we start to lose cognition, we start to lose memory, again, motor of our hands and feet and muscles and different things. We have autoimmune conditions, which is one of the biggest things. RA, Lyme loves to get into the joints. It creates autoimmune reactions. What is that? That is RA, an autoimmune inflammatory arthritis of the joints. Very commonly, I'd say a big majority of my RA patients end up having Lyme. Now, not all of them, but a good chunk of them do end up being Lyme as kind of that root cause. You can have things like lupus. You can have, again, thyroid, so Hashimoto's thyroid, or again, in that first example, Graves'. Again, fibromyalgia, which is really just diffuse pain kind of throughout the body with no real reason, right? It's just kind of I always say a kitchen sink or trash can diagnosis of we're not really sure, but it's just random pain here and there, right? Well, what if that was one of the main things that Lyme said? It can be traveling pain of the joints, muscles, and tendons. Then if we see it in pediatrics, so kids, it's called PANDAS, pediatric autoimmune neuropsychiatric disorders associated with a bacteria, but Lyme. So that's one of the big things too. So again, when we have these issues, when we get these misdiagnoses, this is what we need to look for. Are we getting a bullseye rash? If we have a bullseye rash, it is Lyme, right? So this is how we confirm, is it Lyme or is it not? Okay. Did we get a bullseye rash? If you got it, yes. But just because you didn't get it doesn't mean you're in the clear. A Western blot and ELISA is the most accurate testing that you can get. Okay. And again, if you've had it in the past, go back and check. Is it this test? This is the most accurate. And this one is still only about 60% accurate according to CDC standards. And we'll get into that in just a second. But there's a DNA PCR test, which is the cheaper version and simpler version. And they say it's about 16% accurate or so, okay, compared to what they see with that 16%. That's like pull a straw of a hat and we'll see, right? But even the better one is still at 60, but again, that's CDC criteria. So let me show you what that means, okay? Again, case study here, young female was bitten over a year ago, still has the scar where the tick bit her, okay? Right on like the back of her knee, on the leg, still just black over a year later. Symptoms, she started getting fatigue, joint pain, brain fog, anxiety, and a lady who is very regular with her cycles, just thrown off, right? Never really had that issue before, just started having bad cycle issues, okay? Well, when we dove in, I was like, okay, well, let's test, right? You got bitten, there's still something there. Oh, and the bite mark a year later still itched, right? Right where she did that. So here's what we're looking at, okay? She didn't come back positive for Lyme, but she also didn't come back negative. You're like, well, that's weird, right? Yeah. When we look at it, other than CDC standards, and I'll show you in a second, there's this gray area. So there's this CDC. What does the CDC say? Then what does basically everybody else say? All these different alternatives that have done research and all these different things. They say, well, there's kind of this gray area where there's some evidence there, but it's not enough according to the CDC to be positive. And what do I mean by that? Okay. You can see these bands right here. That's how you're going to get your positives. These bands represent things, right? So let's look at them. Band 66, considered highly specific for Borrelia or Lyme. Band 41, commonly seen in Lyme and other spirochetes. Okay, so again, 41 could be Lyme, but again, not as specific as band 66. 31 can be significant, often linked to late stage Lyme, but may cross react. 41 as above, not as highly specific. So she had one that said, basically, yup, this is Lyme. Band 31 is like, this is kind of Lyme too. Band 41 is like, really could be Lyme, but there's a little bit of wiggle room there. The other one is like, doesn't have to be, but there's still evidence, right? That's how this works. The CDC says you have to have 5 bands that are highly specific. It has to say, yes, we have Lyme, yes, we have Lyme, yes, we have Lyme, yes, we have Lyme, yes, we have Lyme. And they're like, oh, okay, I guess we'll finally say, yeah, you have Lyme. But if you have 4, you go, yep, it's Lyme, yep, it's Lyme, yep, it's Lyme, yep, it's Lyme. They're like, not quite enough evidence for us to say that, right? That's basically how it works, okay? Right? So that's what we're starting to see. Oh, here's another one. Okay. I thought I had one more. I'll show you what that looks like in just a second, okay? But again, when we looked at this, so when you get this equivocal, okay, when you get this equivocal, you need to take into consideration those bands and take into consideration the situation, okay? She got bit by a tick. She had a lot of the signs and symptoms of Lyme, and she came back in this gray area with several of the bands saying, yeah, I'm pretty sure this is Lyme. I addressed it like it was Lyme, right? To me, that makes sense. There's too much evidence pointing in that direction, even though she technically didn't come back fully positive. But what are some of these people on? Well, some of these people never were tested. They're on medications. They're taking over-the-counter medications or prescription medications. These things are being affected by that. Again, they're taking different things. So again, this can be even, this can be affected by other things that we're doing. Here's another case, middle-aged male. He was a farmer. He tested negative 3 times prior. Went to the medical doctor, got bitten by Lyme, had all kinds of issues from there, but tested negative 3 times. Was never tested for any co-infections, but severe fatigue. If he stopped moving, he would fall asleep. Found him falling asleep in the tractor, falling asleep literally in the barn. When he got home at night, his wife would make dinner and be like, you can't sit down, because before she could even call him in, he was sleeping, snoring in the chair. Okay. Couldn't stay awake. Again, had a short fuse, some brain fog, anxiety, gut issues. We ran a more comprehensive test. Turns out, okay, he ended up having Bartonella. But again, we see that equivocal there. So again, not fully positive, but we see that equivocal. And again, we have more evidence that said, yes, this is Lyme. Yes, this is Lyme. Yes, this is Lyme. Yes, this is Lyme. Okay. So again, this is why he tested negative, because again, he didn't technically come back positive to CDC standards, but what did they also miss? They also missed the co-infection, which he did come back positive. So again, to me, he had enough evidence that, yeah, he had Lyme, but he also had a co-infection that went along with it. Okay. So what can you start to do? Okay. Now, right, maybe you've gotten bitten, maybe you haven't, right? What can we do to be preventative as possible, right? Especially like here in the Midwest. I don't want to say it's inevitable, because that's not necessarily true. But how do we minimize that risk, right? If you're going outside, you use different repellents, and we'll talk about a good quality one in a second. White clothes, long clothing, right? Socks, long pants, things like that. Obviously, like if it's 100 degrees, that's not going to be comfortable. But again, This is best case scenario is you try to cover up and create a minimal exposure as possible and avoid high grassy areas. Some of us hike. I like to go tromping through the woods. I go hunting. There's that risk. Okay. But I'm not going to give up all of my happiness and the things that I like to do because of this, right? So again, doing the best we can. As far as repellents, here's what doTERRA comes in really handy. Terra Shield is wonderful. I have it all the time. I keep it in my backpack. We have some at the cabin. We have it everywhere. Okay. If we're going outside and there's a lot of ticks out there, this is what I love to use. It's simple. So there's lemongrass, cedarwood, geranium, peppermint, citronella, those things like that. Like, right, we know citronella candles, those are going to be great. Some other ones that can work as well. There's On Guard, Stronger, Lavender, Peppermint, Tea Tree, Lemongrass, Clove, Thyme, Citronella. Anything really strong, really pungent, especially some of those citruses, lemongrass, the tea trees, things like that. Some of those woodsier ones, cedarwood, whatnot. And we know citronella, right? So again, this is where Terra Shield comes in great. What I love to do is I take the portable diffuser that doTERRA has and put some Terra Shield in it, and I'll bring it onto the deck and I'll bring it out by the campfire and I'll bring it out there. Just let it go, right? That's what I love about the portable one is that you can bring it outside, right? And still use the good doTERRA oils because you go and get a citronella candle, probably not good quality citronella essential oils, probably not good quality stuff that they made the candle out of. So now you're getting toxins with it, right? And we don't want that, right? We don't want to inhale a bunch of toxins while we're trying to protect ourselves from something else. Okay. Other things you can do, there are kind of tick repellent devices, basically make a high pitched noise to kind of repel them. Better than nothing, but probably not the most effective. But again, if you have it, they're not that expensive. Is it worth it? I think so, right? They're 5, $10, something like that. A more expensive one might be 20. But I'm willing to buy it once and use it. And what's the worst that can happen, right? Is it works. So, but then we do go outside. We do have, right, we're going out in the woods, whatever that may be. Just check yourself, right? When you get in the shower, checking all the crevices, everything like that. Just check around backs of the knees and the groin, waist, armpits, hair, right? Just check, okay? Because they can. That's where they love to go. Again, a lot of in the back of the knee and things like that. When we go to remove them, um, we want to try to get the head. A lot of you probably know that, whether we're using tweezers, there's special tools that work really well. Try to get that whole tick, make sure we get that head, try to sanitize that area, and then keep the tick. Put it in a little plastic bag or something like that, throw it in the freezer because you can test the tick itself. Okay, if you start to have issues, you didn't test yourself or whatever that may be, you can test the tick. Okay, so keep the tick if that is the case. Um, and then here's what we're talking about, right? So those are the things that you can do to try to be preventative. But one of the things you can do is getting proper testing. Okay. So good quality testing. Here is our test. We test for Lyme disease and 11 of the most common co-infections. Okay. You can kind of see over to the left. And then I showed you what the results look like. But from that Western blot, this is what this looks like. And if you can see at the bottom, there's CDC criteria and it's either negative or positive. Then the alternative criteria is, well, there's some other bands in that middle equivocal area that there's also positive ones, but you can see the CDC requires you have to have 5 of those in total. Okay, it says 2 or more bands from here and 2 or more bands from there and at least 1 band from there, right? So the CDC makes you have at least 5 of those bands to do that, but there's no equivocal status. But the alternative ones say you can have that kind of gray area, and that's where it comes in of, okay, are we in the gray area? What bands are showing up? Are they the specific ones? And then again, what's the history? What are the symptoms? Put all of that together to try to make your call. Again, that's an example of what that can look like. So what's the part that everybody, I feel like, misses? Okay. We look for Lyme. Let's say we do. Let's say we do test positive for Lyme, right? Whether it's at the medical doctor, through me, through somebody else. Everybody just tries to go after just the Lyme, which again, you need to do, okay? You need to address the Lyme. You need to address the fire. But you also need to look for the co-infections and things like that. But what are the parts that people miss? And I kind of alluded to this earlier, is you need to clean up the mess after that fire. A lot of times this is detoxing, binders, different things like that. Okay. You also need to rebuild the house. Okay. What damage did it do? If all you do is try to put out the fire, there's still a lot more work. Okay. What is this called? Again, post-Lyme disease syndrome. You put the fire out, but the house is still a mess. Okay. You still have symptoms. You still have all these different things. So when we look at things like, let's say, the medical field, you go in, you test positive, the medical field is saying, well, they use antibiotics, right? It's a bacteria. We use antibiotics. Typically, this is doxycycline, and it's shown to be best within the first 7 days. Okay. But when we really look at what the research says about doxycycline is it's great at killing active Lyme. It's one of the most effective at killing active Lyme. Great, right? That's the one causing symptoms and inflammation and problems. But there's two other states that Lyme sit in the body, right? There's the round bodies and then there's the colonized, right? There's two others. It is not good at killing these. Okay. So the research shows that different antibiotics are good at some of those different things, right? Here's some of that research. How are these different drugs good against Borrelia? Again, this is, I'm not trying to make any claims. This is just what the research shows, right? The statement from here is doxycycline and amoxicillin alone do not fully eradicate those persister forms of Lyme. Persister meaning the round bodies in the colonized, okay? So what I want to say about that is if you have been used doxycycline or antibiotic for something like Lyme, there is a good chance that it could still be in the body, okay? That it probably wasn't successful because when we look at that, again, doxycycline and amoxicillin kill actively growing spirochetes well, but have poor activity against those stationary phages, which is the round bodies and the microcolonies. Not fully eradicate those things, okay? So again, that's just what the research is showing. If that's all you do, there's a good chance you don't completely get it. This is where I find, again, whether you go down that path or not, or whether you decide to go 100% natural, either way, you have to use natural things, right? Because there's 2 out of the 3 forms. We only got this one. These things are still over here, okay? So there's natural antimicrobials, things like Japanese knotweed, cat's claw, oregano oil, black walnut, wormwood, berberine, caprylic acid. There's these things that have been shown to actually be effective, oregano oil being one of the biggest ones. GX Assist has oregano oil in it, has some tea tree, clove, different things like that that are also very good for the gut, good with detoxing. Again, it's called the cleansing formula. And what was one of the parts that I said that's missed is detoxing, right? You got to kill the Lyme, but you also have to be able to flush it out of the body. Okay, so something that can be really useful with that. Again, there's oregano oil for you. It can be used right on the skin. Again, dilute it. It's a very hot, very warm, very strong oil. So do not just put it directly on the skin or anything like that. You want to dilute it, but you can, if you do get bit, you can put it around the side of a bite. You can put it around your knee. You can put it around some of those joints. And right. And so again, this can be part of how we work on getting rid of that Lyme out of the body. And again, what I'll say is I don't recommend doing this on your own. I highly recommend finding a professional to help guide you through this because it's not just oh, I take this and everything's okay. Okay. This is not a right. This isn't something to play around with and try and this and try that, and we'll see if it works. I highly recommend finding somebody that knows. I'm one of those. If you want to reach out to me, I can help. But again, we have the evidence here. There's research showing these how these different natural herbs and natural things are actually effective against the Borrelia and against the Lyme and some of these other co-infections. We have the research there. It's not voodoo. It's not anything like that. It's shown. What else can we do? Well, we need to support the body just in general, foundational health and wellness, whether it's preventative in nature, whether you're dealing with Lyme or not, or really anything. This is a great place to start. The VMG plus, the E Omega plus, the PB Restore, your VMG. I kind of call it like your super, like kind of your super, what is the word I'm looking for? Multivitamin. Has like just a little bit of everything, has a lot of the vitamins, minerals, nutrients, all those different things that you need. The E Omega Plus is a really good fish oil, helps support the collagen, helps support the nervous system and the brain, helps support your joints, healthy heart, blood pressure, different things like that. And PB Restore, again, Borrelia is a bad bacteria. This is supporting your good, healthy microbiome, your good, healthy bacteria, your immune system to help, again, with all of that. You need an immune support. Again, what does it trigger? It triggers autoimmune-like conditions. So helping support your immune system, keeping your immune system strong is one of your best defenses. No matter what, whether it's Lyme or anything else, if you keep yourself strong, that's your best chance at fighting anything that you come in contact with. DDR Prime is going to be great for this. On Guard as well. Green tea, which is in a lot of some of these different supplements. I see it in quite a few. Again, you have your fish oils like we saw before. We have our probiotics like the PB Restore, the PB Assist. We have a lot of these different things that can support in these different natures. And when we look at the PB Restore and PB Assist, what some people still, what I want to kind of differentiate is in each of these, there's different bacteria. The best thing to do is to take both. That's going to give you the most diversity of these because the good bacteria that's in PB Restore is different than the good bacteria that's in PB Assist. So really the best thing is to take both so you get as much diversity as you can. What I will say, one of my tricks is, especially with kids and things like that, sometimes it's hard to take a capsule, especially the PB Restore, it's a double capsulated. So sometimes I say if it's just a powder, you can kind of like pop it open and give it and hide it in food. That's really hard with PB Restore. I haven't found a kid that won't take a PB Assist. I call it their pixie stick, right? Even if they just bloop, take it down, it's a way to get them a good probiotic. Again, is there more in that PB Restore? Yes, but again, something is better than nothing. So that's a trick. If you have grandkids or kids or anything like that, and you want them to get to start to take some good probiotic, this is a great way to start. Give them a pixie stick. Okay. Again, we talked about that Lyme being in a biofilm. Here's some biofilm busters. Okay, there's something golden seal. Again, oregano oil, turmeric, garlic, apple cider vinegar, cinnamon, activated charcoal, several different things there, right? Oregano oil, turmeric, cinnamon bark. So these are things that you could have right on hand that can start to break down that colony, break down that protective wall, and get in there and allow you to start to get after that Lyme that's in there. Lyme's not the only thing that creates a biofilm. Okay. One thing too with Lyme is if you're actively going after and killing Lyme, there's something called what's called a Herxheimer reaction. This is die-off, essentially. You kill it. This is one of those times where things may get worse before they get better. And that's just part of it. Lyme, when it's killed, it releases a toxin. So let's say it's in your shoulder, you kill it off and a bunch of toxin is released. Your shoulder might ache a little bit more for a few days as you're killing it off. But again, if you're helping support your body's detox pathways, you're taking different binders, different things to grab onto it and flush it out, you can minimize those and minimize the severity and minimize the time that you're experiencing. A lot of my patients, again, will be like, my shoulder hurt for a couple days and then went away. Then my knee hurt for a couple days and it went away. And then this and that, and things kind of like bounce around like that. And that's part of it. Okay. I usually say, good, it's working. We're doing something right. Okay. I almost kind of want to see some of these reactions because that means that we're actually getting to it and things are working. Okay. But again, I'm we have life, right? We all have lives. We can't spend a month in bed or a couple months in bed, whatever that looks like. So it's this finding the happy middle of we're moving things forward, but at a pace that is manageable for our life. Okay. And if there's a number one thing I can tell you is if you get bitten, do something right now. Okay. Act as fast as you can because the longer you go without doing something, the more likely it is to replicate, spread, kind of get everywhere. Okay. So do something, whatever that may be. Again, if it's calling me, seeing how I can help, my recommendations, do that. I'm just telling you, I would recommend doing something. Again, first 7 days. Okay. What else can you do? Diet. Again, whether it's in general, whether you're battling Lyme, the co-infections, something else, diet is really important. You want to support your immune system. You don't want to dampen it. So sugar is a big one. Sugar is going to weaken your immune system. If you have Lyme, if you have autoimmune conditions, right, you're going through any of these things, that's going to affect it kind of drastically, right? So working on those things. The big thing is collagen support. Okay, again, it loves the collagen, which is the joints, your gut, your skin, your tendons, your ligaments, your eyes. A lot of your body is connective tissue, that collagen. So regrowing and repairing it again, bone broth, collagen protein, and some of that metapower. Okay. MetaPower Advantage is great. Again, it has that collagen support with some other things in there as well. But again, can help support that part of the system. Okay. I know we covered a lot. All right. Sandy, we're like right on time. That was golden. Okay. So I know we covered a lot, right? I hope you guys learned something. What I want to say is, again, if this resonated with you, if you've had Lyme in the past, if you haven't, if there's some suspicion of it, okay, I can help. Or again, if you think you've had it but you even failed test, let's double check, right? So what I will say is for joining tonight, for watching this, and sticking through, what I want to offer you guys is if you're interested in getting some Lyme testing, again, it would be testing for Lyme and 11 of the most common co-infections. Okay. What we'll do is we'll run that test. We'll sit down. We'll go through everything, say, here's what we got, here's what's going on, and we'll make a plan. If it's there, awesome. If not, right, you're doing it for a reason. So we'll make the next plan and at least we ruled it out. Okay. Typically, this is around $850 at our office. If you join tonight, we're cutting it back to $679. I will be honest, this is very, very cheap for Lyme testing. I reached out to two other of my companies that does Lyme testing. The cheapest I could get half of that test was $2,000. Okay. They would test Lyme in 3 of the co-infections for 2,000. I had a patient bring my Lyme test to her medical provider. They were going to charge her 4,000 for it. Okay. It's expensive, but for whatever reason, the Lyme testing is expensive. I'm not a lab person, so I don't know the details, but I don't think you're going to find it much cheaper than this. Okay. And I'm not trying to push you to do it, but I'm just saying if you go in out there and look, you're going to pay for it. So 679 again, myself. Um, I'm probably the one that you're going to be looking for. If somebody calls the office, they send them to me if it has to do with Lyme. So again, the Lyme test and 11 of the most common co-infections, we'll do a consultation, we'll sit down, we'll go through it, and we'll make a plan from there. We do virtual appointments as well. So anybody, anywhere, no matter what state you're in, we can help and we can get this test done. I'll send you the test and help you find a local blood draw site. So it'll come right to your door. You just have to get your blood drawn. Then we sit on the phone and we go through it just like you were in person. Okay. So that's what I want to say. Again, thank you guys for joining. I hope you learned something tonight. I hope I broke some myths out there and gave you some good kind of tips and tricks as well.
Dr. Shane, there's somebody asking about out of state. Can you just briefly go over that before I start wrapping up?
Yeah. Here, let me do this. Yeah. So out of state, 100%. So I have patients in basically all 50 states. And so anybody well, I do have it in all 50 states, actually. There are a couple states that are tricky, but if you're out of state, we can do this deal as well. Again, what I'll do is if you're interested, again, this or any testing or anything like that, any of our care, I can ship directly to you, these tests, whatnot. I'll ship right to your house, or I'll help you find someplace local. And then when the results come back in, then we just do a phone consultation and go through all of it. So pretty simple. We've got it kind of down. Again, anything you need, we ship right to you, or we help you find local.
All right, I'll let you look at the questions while I wrap up. So thank you so much.
Mm-hmm.
All right, for those of you that have not joined the Discovery Central Facebook group, I'd recommend that you do that, as well as the email list. Folks, reach out. When is the recording available? I know when it's drop shipped right to my email. Love it. Please do this. Click on the bit.ly links there, and you'll get those delivered to you. I'll leave this on just for another second and take a look at that, because there's a lot of good information out there as well. Okay, a number of you are graduating. A couple of you reached out about it February 18th. They did a lot of digging and found out that only about 6 people got registered for that. And they were all, you put it in, but it just didn't get logged. Something was faulty in the system. They did update everybody on that. And so watch that. The oils and the gifts, they don't have a drop ship date yet. They'll keep us posted. But they know that everything that's in the system, we cannot go back. They're not going back. Whatever you have in the system is totally updated as of right now. So go to bit.ly/grad progress 2026 to see if you graduate tonight. And if you do, make sure when you go to bit.ly/continuing ed 2026, these are case sensitive. You can put in there that you graduated. And what does that mean? We're going to talk about that next. There is a lot of information in the permanent library. Please check it out. bit.ly/permanent library DE for Discovery Essentials. Wonderful, guys, education out there. So if you graduate tonight, you can pick either of these two, or put in there the teachable course. And if you've already done this, there's no better gift than to gift this to someone else in your downline, the essential oil certification. $97 value, definitely much greater value than any of these. And go ahead and gift that to somebody. That would be a wonderful gift. 3 types of people that use doTERRA: live, share, and build. Who now, as what Dr. Shane has shared tonight, is not wanting to live a lifestyle change. And definitely we want to be, as wellness is, without our health, we don't have anything. So how do people buy it? Retail, wholesale, and below. I am all about below wholesale. And how? Click on that QR code for the enrollment kits. I ordered 3 this last month, guys. I was so low on product and just found what kits match best. I was running low also on my Aroma Touch. I ordered the kit instead of oils. There are 4 or 5 of them in there that I needed. Purchase the kit. So a great way, if you're joining tonight at a 150, you can pick up any one of these. But it's bit.ly/enrollment kits US, and that is all case sensitive as well. Please reach out to me if you've got questions, or email me, text me, whatever you need. It's all there with class questions. I just got some more speakers this week. I'm very, very excited with some of the new speakers that we've got coming on as well. I got somebody also, a new doctor coming on now about health with toddlers and babies even. I'm excited about that. So I am going to have Dr. Shane, we're going to stop the recording in just a minute, from 5 to